Hi, this is Dr. Murray from Murray Natural Integrated Health here in Hastings, Nebraska, doing a short video for you here today. Today we're going to be talking about active care versus passive care and how that relates to medical care in general. So active care is really when you take an active part in your treatment plan. When physicians make plans for you, they're constrained by certain types of protocols, and these protocols are often based off of passive care. Passive care where you're really not taking a whole lot of your time and interest into the particular care plan. You're just there, you get a pill, and you leave. When you just go in, you get a pill, they spend 5 minutes with you, they give you a pill, even if they came in here and we just gave them a supplement or some type of even a medication, and they just walked out the door, they're here for 5 minutes, and they walked out. That is passive care. You're not really involved in the process. Active care, you have a much more intimate involvement in the process of care. And so that might mean that there's more education involved. That might mean that there's more dietary or lifestyle involvement at home. So majority of medical care is based off of that passive care type of presentation. And unfortunately, that type of care is not really designed to get to root causes of problems. So for instance, if you have hypertension and you give a blood pressure pill to somebody and you brought their blood pressure down from 210 over 110 down into normal ranges, you have saved a person's life as a medical provider, but you really haven't gotten to the root cause of the problem. So you need to get the root cause of problems. And that's why if you have diabetes or pre-diabetes, you probably have not had your insulin levels tested at your physician's offices. I imagine they haven't, because that's not really protocol, because they're interested in giving you a medication, metformin, a variety of other medications to just bring your blood sugar down, and not really getting the root causes and seeing if your insulin is high or low and the reason why you have insulin resistance. Same thing with testing for omega-3 fatty acids. Around 90% of Americans don't get enough omega-3s in their diet. You can have your omega-3s tested, but they don't test them. It's not in their protocol, so they don't test it. And we know omega-3s are good for your heart and blood pressure and your brain and everything. And even if you have metabolic syndrome, you have a slow metabolism. They often are not testing your reverse T3. They're not testing your sex hormones. They're not looking for those root causes. And those are the reasons for a lot of metabolic dysfunction, our hormones being off, and not just your TSH or T4. So you need to get the root cause of the problems. You need to also, if somebody isn't listening to you, sitting down and you're saying, I want to be involved, actively involved in my care, please help me out. If they're not listening to you and doing the right testing, you need to go to a provider who can do that for you. Give our office a call for a free consult. This is Dr. Murray, Murray Natural Integrated Health, setting the standard in natural health care. Have a blessed day.